Steno peeps, welcome back to a brand new dictation. Sorry for the delay. I know I skipped a few days. School is getting intense, so I'm trying to keep up as best as I can. Today we're going to do a literary dictation. This is going to be all centered around schizophrenia. I thought that was just a wild word to try to write to begin with, so figured we'd do a whole dictation around it. This is at no particular speed. Set your speed controller and let's get started. Schizophrenia is a complex and often misunderstood mental health disorder that affects how a person thinks, feels, and behaves. It is characterized by disruptions in cognition, perception, and emotion, and can profoundly impact an individual's daily functioning. The condition typically emerges in late adolescence or early adulthood, with men often showing symptoms earlier than women. While it affects only about 1% of the population worldwide, schizophrenia's impact is significant, making awareness and understanding critical. One of the hallmark traits of schizophrenia is psychosis, which involves a disconnection from reality. Psychotic symptoms can include hallucinations, delusions, and disorganized thinking. Hallucinations are sensory experiences that occur without an actual external stimulus, most commonly in the form of hearing voices. These voices might offer commentary, give commands, or engage the individual in conversation, often causing distress or confusion. Delusions, on the other hand, are fixed false beliefs that do not align with reality. A person might believe they are being persecuted, that they have extraordinary abilities, or even that they are a historical figure. Disorganized thinking is another core feature of schizophrenia. This symptom manifests as fragmented, incoherent speech that can make communication challenging. A person might jump from one topic to another with little connection, or their thoughts may become so jumbled that they are difficult to follow. In addition to these positive symptoms, so-called because they represent the presence of abnormal experiences, schizophrenia also involves negative symptoms. These refer to deficits or reductions in normal emotional and behavioral functions. Examples include flat affect, where a person's face and voice lack emotional expression, and anhedonia, the inability to feel pleasure. Other negative symptoms might include social withdrawal, lack of motivation, and difficulty maintaining personal hygiene. Cognitive symptoms such as impaired memory, attention, and executive functioning are also common but less overtly recognized. These deficits can affect problem solving, decision making, and the ability to process new information, which further challenges individuals in their daily lives. While the exact cause of schizophrenia remain elusive, researchers agree it arises from a combination of genetic, environmental, and neurobiological factors. Genetic predisposition plays a significant role. Individuals with a family history of the disorder are at higher risk. Environmental factors such as prenatal exposure to infections or malnutrition, and significant stressors during early development can also contribute. Neuroimaging studies have revealed structural and functional brain abnormalities in people with schizophrenia, including differences in the size of certain brain regions and disruptions in neurotransmitter systems, particularly dopamine and glutamate. Treatment for schizophrenia typically involves a combination of pharmacological and psychosocial interventions. Antipsychotic medications are the cornerstone of treatment. These drugs help reduce the intensity of psychotic symptoms by targeting dopamine pathways in the brain. Second generation or atypical antipsychotics are commonly prescribed due to their reduced side effects compared to earlier medications. However, side effects like weight gain, drowsiness, or movement disorders remain challenges that can affect adherence. Psychosocial interventions complement medication. Cognitive behavioral therapy, or CBT, can help individuals challenge distorted thoughts and develop coping mechanisms. Social skills, training, and vocational rehabilitation aim to improve daily functioning and integration into the community. Family therapy provides education and support, fostering a more understanding and supportive environment. In some cases, hospitalization may be necessary during acute episodes to ensure safety and stabilization. All right, that is a wrap. You got some good medical terminology in there. That was a full 7 minutes, so going a little long distance there to get some endurance in. So keep practicing. If you want to practice this one again, be sure to like it so it gets added to your liked list. And be sure to subscribe if you haven't so you can stay tuned for the next dictations to come. And I'll catch you on the next one.